One of the trials or one of the correlative studies that we're presenting here at GU ASCO is on PD-L1 assay concordance. And so there's multiple PD-L1 assays these days, both from DACO and from Ventana, 4 different antibodies that have been separately approved as companion diagnostic assays with their respective immunotherapy checkpoint inhibitor. So the DACO 22C3 assay, for example, is paired to pembrolizumab. The DACO 28-8 assay is paired to nivolumab, and so on. So our objective for that study is really to think about, which assay, do the assays correlate in terms of positive versus negative, and do the assays make a difference when we're thinking about bladder versus kidney cancer. And so we picked 2 of the assays within each disease type that were routinely used and were more clinically relevant in terms of what immunotherapy checkpoint inhibitor is used in that disease type. So in bladder cancer, we picked both the DACO 22C3 antibody for pembrolizumab, as well as the Ventana SP 263 assay for durvalumab, and compared the 2. In renal cell carcinoma, we picked the DACO 28-8 assay, as well as the Ventana SP 142 assay that's linked to atezolizumab. And so using these assays, we partnered with our pathology collaborators to really drill down on tissue-specific correlates of calling positive, negative assays, specifically training them on each of the assays based on the antibody type, and then subsequently evaluated for concordance and discordance. And so the vast majority of these, the 2 within each disease type, the vast majority of tumors correlated in terms of PD-L1 positivity or negativity. It was really only 1 or 2 tumors within each group that were discordant. So I think it's a really relevant trial, really relevant correlative study where we're looking at tissue testing of PD-L1 positive, negative status to think about driving management for our patients.